My name is Dr. Marty Martin, but you probably know that already, but it's always good to reintroduce yourself. I want to talk a little bit about this particular topic that we're going to look at. It's called Entrepreneurship Initiatives in the Health Sciences. A little backstory to this particular presentation. So as you may know, I'm a Coleman Entrepreneurship Faculty Fellow, and one of the things that we do is we get together in the summer in August, typically within the suburb of Chicago, to really share our experiences as faculty fellows with regard to teaching entrepreneurship. So this was one presentation that I gave at one of the forums that we had in August, and I wanted to share it with you because I think it's very important for you to have an understanding as you're taking this course about what entrepreneurship is and how it can add value specifically within the health sciences as well as the health sector. So that's really my rationale. So let's begin with the metaphor of a horse race. So when you think about entrepreneurship, I often think about racing horses. And you can fairly ask the question, what's the connection? So here's the connection. The horse is really, if you will, the innovation. So why is the horse the innovation? The reason why the horse is the innovation is there's all types of breeding and kind of genetic manipulation that goes on with regard to making sure that those horses are kind of biologically enhanced, if you will. There may be some ethical implications to that as well that I'm not going to address, but the horse is the innovation, and there's a whole industry behind that. So if that's the case, what's the role of the jockey in the horse race? The role of the jockey is the entrepreneur. So if you really kind of take a look at it is you're the entrepreneur, but if you only have the entrepreneur and nothing else, then you're really not going to have anything that's entrepreneurial, because what you also need is the innovation. And it really is, if you will, it's the marriage of these two together that begin to have you launch the entrepreneurial initiative. But there is another element that's critical, and that's the community or the environment as well. So if you take a look at this particular picture here, you see the horse, you see the jockey, you see the track, you see the crowd. So when you think about entrepreneurship in general, and particularly in health sciences, you need all three elements. So that's very important to think about, and I'll talk about each one of these as we go through the presentation. So this is the way the presentation is organized. First, we're going to talk about the entrepreneurial tradition in health sciences. Then we're going to talk about the emerging entrepreneurial ecosystem nationally, but also a bit in the Chicago area as well. Then talk about entrepreneurial education, and then entrepreneurial education at our institution at DePaul, and entrepreneurial education in other places as well. So let's begin with the entrepreneurial tradition in the health sciences. So this may seem a bit odd, but health insurance itself represented an innovation, and that occurred in 1929 with the Baylor Health Plan. So when you think about an innovation, it's not only products, goods, and services, but it's also things such as health insurance. Accountable care organizations are an innovation. So there are hosts of different types of innovations. You also, if you take a look at the Minute Clinic there, so the Minute Clinic is a type of care model that's associated with companies like Walgreens and CVS, although they call their clinics different things. Those are innovations. I would encourage you to look up a company called Theranos. Theranos is really making a big splash in the healthcare entrepreneurial space as it relates to testing a number of different diseases, not with a big vial or tube full of blood, but just with a single droplet of blood. It's controversial, it's revolutionary, it's disruptive. They're having some false starts now, but I predict that within the foreseeable future, either Theranos or other companies will be able to resolve some of the challenges and move ahead. So the short of it is this. When we tend to think about entrepreneurship, we tend to think about high tech. We tend to think about data, big data, analytics, Microsoft. That's all well and good, but also think about biotech. Think about pharmaceuticals. Think about health delivery. Think about health plans. So there is a long tradition of entrepreneurship in the health sciences. So I'm reflecting back on my training as a clinical neuropsychologist at Rutgers. And we were really trained, to really think about developing our own practice. And if you take a look at this acronym here, so the school is called the Graduate School of Applied and Professional Psychology, or it's called GAZAP for short. And the GAZAP for short, what we used to say is get self a private practice on Park Avenue. Because most of us were headed towards launching our own practice. So it could be an individual practice, could be a group practice, but we were definitely moving forward launching our own practices. So self-employment also is regarded as a form of entrepreneurship. So it doesn't have to be an IPO, which you're a publicly traded organization. It doesn't have to employ thousands of people. It could be a 2 or 3 person shop, if you will. So within healthcare, you have a number of practitioners from dentists, massage therapists, acupuncturists, psychologists, psychiatrists, physicians, a whole host of healthcare professionals that in fact are entrepreneurs or self-employed. Now some of you may have heard of a company called Epic. So Epic is I think it is the single largest EHR company in the country. It's based in Madison, Wisconsin. And let me tell you a little bit about the backstory of the founder of Epic. Epic had its early beginnings back in 1979. And if you note in terms of the founder of Epic, what's amazing is undergrad math major, and then as a graduate student, computer science. So that's not too surprising as to those two particular disciplines. But then she gradually began to form this very, very large company. And she started this company with how much money? $70,000. So there's a misnomer out there is that you need 5 million, 10 million. You need to have an IPO. You need angel investors to launch a company. False, false, false. Now, $70,000 is a lot of money, but it's not $700,000. So if you're thinking about an entrepreneurial venture, you say, well, I really don't have the capital. How much capital do you actually need? You may be able to launch this company with a little bit of capital, and then as you meet with success, then you begin to grow that capital. So again, we're still looking on the tradition of entrepreneurship within health sciences. So one of the things that you're quite familiar with is if you happen to be a scientific major and you're enrolled in the health sector management program or the health informatics or predictive analytics or health communication, is about the scientific method, which is really about experimentation. So when you look at the scientific method, it is very similar to something that's called build, measure, learn. And build, measure, learn is one of the core concepts that was profiled in the book called The Lean Startup. So let's say you're going to start a venture. So when you start that venture, you're going to build it. You're going to build a prototype. You're going to throw it out there. You're going to get some customer feedback with some metrics, and that's where the measure comes in. Then you're going to learn from that, and then once you learn from that, you're going to iterate. So what you will note is this build is very similar to experiment. This measure is very similar to the metric, and this learn is very similar to the hypotheses. That's why you have the link between the two. But Lean Startup uses this language, and then within the scientific community, what we tend to use is this language. So that shows you once again is methodologically there's a pretty strong link between the two. So now let's pause and go to the emerging entrepreneurial ecosystem. It's a mouthful. I guess you could call that E cubed, if you will. So if you take a look at this map looks at the entrepreneurial ecosystem within biotechnology. And as you go down here, you can see that as you get darker, you have more concentration of particular biotech firms. So let's go to our home state here. We're sitting here in Illinois, And we have 65. So where does 65 fall? 65 falls right in the middle there. So we have a fair amount, not too many, but a fair amount here. Now if you go to states such as Texas here, they're at about 101. You go to the dark states, you got California here, heavily concentrated, Maryland, Virginia, heavily concentrated, Massachusetts, heavily concentrated. So you see heavier concentrations in those particular areas, which begs the question, why? In general, NIH, National Institutes of Health funding, really serves as the basis for the development of an emerging entrepreneurial ecosystem. Now, one of the things that's not highlighted on this particular map is what's happening not just in the state of Wisconsin in particular, but what's happening within Madison, Wisconsin in particular. So within Madison, there are about 140 some odd biotech medical device firms. Why? Because the University of Wisconsin at Madison does a fantastic job of attracting funding from the National Institutes of Health and National Mental Institutes of Health. So they really have become a magnet for biotech within the Midwest. So again, let's look at the top 10 states. If you look at that diagram, so the top 10 states in NIH funding. So if you'll note, you see California. So California's linked here. If we go to Massachusetts, Massachusetts is over here. If we go to New York, you got New York over there. Pennsylvania, you can hardly see. North Carolina, oddly enough. Why? Because you have the research triangle in North Carolina. So Raleigh-Durham area, a lot going on there. And we should be proud, because even within our home state of Illinois, Illinois shows up on the map. So the lesson here is if you're interested in biotech medical device and increasingly health care innovation, is Illinois is a great place to be. It's not the best place, but it's a great place to be. So this just shows you just some of the digital health companies that have begun to emerge in about the past 10 years. 509 companies valued collectively at $7.05 billion in funding. So I would encourage you is to go to the website called venturescanner.com if you want to keep up to date as to what's happening within the venture community, and particularly look within the digital health landscape. So when you think about entrepreneurship, it's not just biotech, medical devices, pharmaceuticals, but it's also the emerging digital sector as well. So that's another area that you may want to take a look at. So now let's take a look at what's called I-Core funding. And what I stands for is innovation. So the National Science Foundation, and the National Science Foundation is an arm of the federal government. What they said is we've been giving a lot of grants to scientists, and they're doing great work and they're publishing in peer-reviewed literature, but what they're not doing is necessarily translating that science into innovative products and services, and they need to do so. Now you also have another government agency called SBIR, so it's Small Business Innovation Research, and it's really a program, if you will. It's not an agency per se. And as a program, each one of the federal agencies, could be NIH, could be Department of Defense, could be Department of Agriculture, they have an SBIR program, which is open to for-profit institutions that want to innovate something related to science. So in other words, the SBIR program functions as venture capital for the federal government. So let's take a look at kind of moving from discovery through development through commercialization. So both the I-Core as well as SBIR, the focus is on commercialization. So as I said, it really begins with university research by academics. So then what happens is it moves along, and then you're going to have investors, but the investors are only going to get interested typically after there's been some startup funding through SBIR or maybe through some grants. And then finally you get to the point where you want to have an industry that emerges. Because when you have an industry that emerges, it may have a positive spill-off for jobs, a positive spill-off for more money within the economy, and that's a good thing. So fundamentally, when you think about what the federal government and the state government is seeking to do by leveraging health sciences is job creation and research that's translated into innovation, that's translated into goods and services that attracts investors may result in jobs. And that's a good thing for everybody. So let's take a look at where do these innovative efforts focus upon? And I want to talk a little bit about innovation centers. So when you think about innovation centers are housed within hospitals, universities, healthcare organizations. And there's a growing number of innovation centers within hospitals and health systems. The California Endowment for Healthcare, they did a survey and they found there were about 148 innovation centers within hospitals and health systems. So the vast majority of these centers are now innovating on care coordination. Care coordination is extremely important with regard to the Affordable Care Act. Disease-specific outcomes, could be diabetes, could be schizophrenia, providing access, even for those that have insurance, engaging patients to take better care of themselves, workflow efficiencies, as well as population health. So I'm not going to go completely down the list, but if you review this, it gives you a sense of some of the important areas that are being innovated today within the healthcare space. So now let's look at frontline providers that are engaged with innovation centers. And this is quite striking to me because if you note, who really takes the lead on this are, you got the physicians. So the physicians are taking the lead, and then it follows through with the nurses, the mid-level providers. So it could be nurse practitioners, could be PAs, then you have care managers and pharmacists, and it goes boom, 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 boom. So those are some of the frontline providers that you want to be able to engage with regardless of the particular innovation that you are focusing upon. So now let's shift our discussion and look at entrepreneurial education and health sciences. And this is hopefully part of what you're experiencing in this particular course. So I'm just profiling some programs that are well-renowned nationally. So one of them is Health Sciences Entrepreneurs at Northeastern University. The other is the UNC, the Gilling School of Global Public Health. They focus primarily on public health entrepreneurship. You see there Drexel is focusing on medical devices. On the top there, Master of Science in Biotech. And then Rice University. If you're interested in really a business pitch focused on healthcare, Rice University Business Pitch is the place to be for healthcare. And then Northwestern has Newvention. So we're also doing some things at DePaul as well, but I wanted to present you what's happening at the national scene. So now let's focus on here at our organization, at our institution, DePaul. So hopefully you recognize who this gentleman happens to be. So he is St. Vincent de Paul. So St. Vincent de Paul, before he was a saint, was Vincent de Paul and was somewhat wealthy and dedicated his life to serving the poor. And that still is the case for DePaul University. It's really about serving the poor, and you can do that in many different ways. One of the beautiful things about healthcare is healthcare, at least in the United States and even globally for that matter, is indeed focused on serving the underserved, medically underserved, those that are impoverished. So there's great alignment between the work of St. Vincent de Paul and the work that we're focusing upon this course and other courses. So some of you may not know, but we have a Coleman Entrepreneurship Center. And the Coleman Entrepreneurship Center provides you with knowledge, skills, support, and resources for you to begin to actually launch a venture, as a student. And I think it's important for you to keep that in mind. So I would encourage you to Google it or go search it on the DePaul's homepage or go to the DePaul Center. And if you go to the DePaul Center and you go on the 7th floor of the DePaul Center, then you can find the Coleman Entrepreneurship Center. So it's extremely important for you to know that the faculty, myself and others, as well as staff are here to support you, as well as alumni, if you want to take this beyond an academic exercise into something that's real, that'll have a positive impact on you and others within the Chicago community and maybe the larger community. So I want to share with you something that I'm involved with my colleague, Dr. John Mazzio, within public health. It's just one example of what we're beginning to do with regard to entrepreneurship in the healthcare space. So if you take a look at this first section here, so MPH 600, so within that particular course in the public health program, part of it's about identifying opportunity, and they do an exercise which is called the marshmallow exercise. So those are two critical skills that they learn. Then in management MPH 513, they learn how to conduct a feasibility analysis, and then they go through the business model canvas. Then finally, we encourage these students to participate in innovation pitch and launch DePaul as well as a new venture challenge. So our belief at DePaul is what you learn in the classroom, you also ought to begin to bring it to bear, if you will, in actual real-life events and real-life entrepreneurship that's reflected here in number 3, or those things which are experiential. So that's extremely important. That's just one example about what we're doing with regard to entrepreneurship within public health. So please email me at martym@depaul.edu or stop by so that way I can support you in your particular entrepreneurial interests or dedication, if you will. So this is just an example of some of the work from one student group that began to take a look at entrepreneurship. What they started up was something that's called the Quality of Life Care Navigation. And the tool that they used is called the Business Model Canvas. So let me kind of walk through this particular tool to illustrate that through some of the assignments that you'll learn, how this actually is very practical and relevant. So the first thing you want to do whenever you look at a business model canvas is you want to go to the customer side. So if we look at the customer segments, they're looking at patients at the end of life as well as healthcare providers. Then you want to look at what's the relationship with the customer. So patients, personal, hospital initiative. What are the channels? So in other words, how are they going to reach the patients? They're going to do face-to-face, they're going to do online, and they're going to do telemedia. So then you begin to go to what's your value proposition. They're going to train physicians and have a patient navigation system. So you always begin with the customer segment and your value proposition. Then you go to look at what are the key activities to make the value proposition happen. What are the key resources that you need? Who are the key partners that you need? What's going to be your costs? And what's also important as well is not just your costs, but are you going to make any money from this venture as well? So that really goes to your revenue streams. So this is just one example of a tool that's called the Business Model Canvas, which shows you actually something that actually exists, and this is a creation of some of your fellow DePaul students. So with that, I'd like to thank you very much, and I really hope that this presentation has provided you with a good background as to what's happening in the entrepreneurial space overall within the Midwest, within the Chicagoland, as well as at DePaul. Please contact me at martym@depaul.edu such that I can be helpful and point you to the right resources. Thank you.